Turmeric, a golden yellow spice, has been a cornerstone in traditional medicine for centuries for its potential health benefits. This vibrant spice is not just for adding color and flavor to our food. It's packed with an incredible compound called curcumin. Now, curcumin is widely known for its anti-inflammatory and antioxidant properties. And guess what? This has made turmeric and curcumin supplements super popular, with people using them for everything from keeping joints healthy to boosting the immune system. But here's a twist. While these supplements are often perceived as natural and safe, it's crucial to acknowledge that turmeric and curcumin are not free from side effects. So in this video, I will share with you the serious side effects of turmeric and curcumin, especially if you are taking them in large amounts or for a long time. You see, it's super important to be informed so we can make sure we all use these supplements smartly and safely. DrJedosaThePharmD here. Welcome, and please like and subscribe to the channel. Number 1. Gastrointestinal or stomach issues. Now, turmeric can cause gastrointestinal or stomach issues due to its active compound curcumin, which can irritate the digestive system. This is especially pronounced when consuming highly daily doses that exceed 1000 milligrams of curcumin. And the common symptoms associated with gastrointestinal issues include stomach upset, bloating, nausea, and in some cases, diarrhea. It's usually nothing too serious, but definitely something to be cautious about. However, it's worth noting that it can be more severe and challenging if you have pre-existing digestive problems such as acid reflux or stomach ulcers. You see, turmeric's ability to stimulate the stomach lining to produce more gastric acid can exacerbate these conditions. And if you have existing gastrointestinal problems, it's advisable to start with a small amount of turmeric or curcumin and gradually increase the dose while listening to your body. Plus, here's a pro tip for you. Taking turmeric with meals can help mitigate the side effects and make it more stomach friendly. Number 2. Kidney stones. Here's the thing. Consuming large amounts of turmeric or curcumin can lead to kidney stones. So why is that? Well, here's the science behind it. Turmeric contains a high content of oxalate, which is totally fine in small amounts. But here's where it gets intriguing. When you consume it in large quantities, it can lead to the formation of crystals in your pee, leading to the development of painful kidney stones. Now, understanding risk factors is key to prevention. For instance, if you have a history of kidney stones, particularly oxalate stones, know that you have a higher risk when consuming substantial amounts of turmeric. And also keep this in mind. When you are shopping for turmeric, you may think you are getting pure turmeric, but sometimes that's not the case. This means some products out there are mixed with cheaper ingredients and fillers. And guess what? These additives are not always listed on the label. Also, here's something else that is super important for you to know. Some turmeric products have been found to contain lead. Yes, lead. This is serious because lead poisoning can cause damage to your nerves and kidneys. And as you can see, it's a big deal, so make sure you're buying from more reputable sources. Number 3. Risk of bleeding. An often overlooked aspect of turmeric is its impact on blood clotting. Curcumin, the active compound in turmeric, has natural blood thinning properties. This means it can inhibit blood clotting to some extent and increase the risk of bleeding if you are taking blood thinners or have bleeding disorders such as hemophilia. In fact, taking turmeric with anticoagulant or blood thinner medications like warfarin, aspirin, and clopidogrel can amplify the blood thinning effects of these medications, further increasing the risk of bleeding. So what is the takeaway here? Well, it's a smart idea not to combine turmeric with these medications. And keep an eye out for some telltale signs that may indicate too much blood thinning. These include unusual bruising, nosebleeds that happen more often, or if it takes longer than usual for minor cuts to stop bleeding. Number 4. Gallbladder problems. Let me explain. Turmeric stimulates the gallbladder to contract and produce more bile. Normally, this is fine, but here's a catch. If you have gallbladder disease, like gallstones, this increased activity can cause pain and complications. This does not mean you have to give up on turmeric completely. It's all about using a small amount. You see, for most of us, a small sprinkle of turmeric when cooking our meals is perfectly fine. The key is moderation. But here's the problem. If you have a history of gallbladder issues, it's a good idea to chat with your doctor before going big on this yellow powder, especially when it comes to taking turmeric supplements. Remember, your well-being is always worth conversation. Number 5. Low blood sugar levels. Interestingly, the impact of turmeric on blood sugar levels needs careful consideration, especially if you have diabetes or are taking blood sugar lowering medications. Here's the thing. Turmeric, or more specifically, its active component curcumin, can affect your blood sugar levels. That's right. In fact, some studies show that curcumin can help your body use insulin efficiently, which in turn may lower your blood sugar levels. This sounds great, but here's the issue. If you have diabetes or are taking medications to lower your blood sugar, this can get tricky. You see, this may lead to hypoglycemia, a condition where your blood sugar levels dangerously drop too low. And trust me, hypoglycemia is not something to take lightly. It can make you feel dizzy, confused, and in severe cases even lose consciousness. So it's imperative, if you have diabetes or are taking blood sugar medications, to approach turmeric supplementation with caution. Now, before we wrap up our discussion on turmeric and curcumin, it's crucial to understand that the side effects we have covered are not a complete list. Beyond what we have discussed, turmeric can also cause other potential issues. This can include headaches, skin rashes, and even an impact on iron absorption. You see, high turmeric consumption can affect how your body absorbs iron, leading to iron deficiency. So you may be asking yourself, what is the golden amount of turmeric or curcumin should I take daily? Well, the recommended daily dose of curcumin should not exceed 3 mg per kilogram or 1.4 mg per pound of your body weight. By sticking to this guideline, you can enjoy the benefits of turmeric while minimizing the risk of side effects. And there you have it. Remember, knowledge is the key that unlocks the doors to a healthier and happier you. Thanks for watching.